18 years after setting up its National Trachoma Elimination Program, Ghana becomes the first country in Sub-Saharan Africa to eliminate trachoma as a public health problem. Since the 1950s, trachoma has been the most important cause of blindness in Ghana, with over 2.5 million people at risk nationally and an estimated 13,000 people suffering from trichiasis. This eye disease, which spreads through contact with infective eye or nose discharges, keeps entire communities in a cycle of poverty, and women are affected up to 4 times as often as men. In 2007, following the launch of the Get 2020 initiative, the National NTD program implemented the SAFE strategy, including surgery to correct trichiasis, antibiotics to treat chlamydia trachomatis infection, facial cleanliness to reduce transmission, and environmental improvement of water and sanitation to reduce transmission.
Trachoma elimination happened with the use of the SAFE strategy. Now, for us, Ghana Health Service, we were involved in the 2 major components, the antibiotics distribution and then the surgical intervention.
The elimination of trachoma demanded the mobilization of an army of experts and community health workers. Following an intense training, volunteers roamed villages to screen for potential trachoma cases and submitted a list of suspected cases every 2 weeks to the health sub-districts. Ophthalmic nurses would then visit houses to screen school children and their families, while the identified cases of trichiasis were reported for surgery and other trachoma cases were treated with antibiotics administration. Thanks to a donation from Pfizer, over 5 million doses of antibiotics were distributed to affected communities throughout the country. In order to raise awareness and ensure that communities understood not only what trachoma was, but also how it was transmitted and how to avoid it, Ghana Health Services and its partners maximized local communication channels. Jingles urging community members to fight against the disease in local languages rapidly became popular on community radios. Teachers and community leaders were all mobilized to finally put an end to this disease.
It is important to train teachers, first of all, because children are very vulnerable so long as trachoma is concerned in areas that water is a problem. So if they have the knowledge about how to prevent trachoma and how to control it, they'll be able to impact this knowledge to the children, and these children are agents of change in the community.
While the National NTD program and its partners ensured that latrines were built and that the communities had increased access to safe drinking water and proper waste disposal, volunteers and health workers focused on keeping the community clean.
Gone are the days where you used to see children who will wake up in the morning and you could see the discharges coming, whitish discharges coming out from their eyes. Especially during vacations, they don't need to bath, because they only used to bath when you have to go to school. But no school, no bathing. But now, bathing is a part of them. When you, at least everybody now baths. It's really hard to see a child who will walk around without the mother bathing the child. There's actually a behavior change.
We need to make sure that surveillance is in place. As I speak now, health staff in all the 2 regions, frontline health workers have been trained so that incidental cases of trachoma could be picked and managed, and make sure that the health system strengthened, whereby the facilities will have enough of the equipment that they will use in case somebody has trichiasis and reports to the hospital.
The success of the trachoma fight in Ghana lies in powerful partnerships, the donation from Pfizer, strong commitment from all stakeholders, and effective mobilization of the affected communities.
Through the leadership of the Ghana Health Service, Ministry of Health, coordinating and bringing all partners on board and ensuring that every partner felt very welcome, every partner's contribution was very well acknowledged, and working together with that level of partnership, Ghana was able to go far.
In June 2018, the WHO certified Ghana as having successfully eliminated trachoma as a public health problem.
Where still other 25 countries in our region still have to eliminate trachoma as a public health problem. So I would appeal to them to say, yes, you've done very well and congratulations, and you can do it again in other countries. WHO and SPED will work with you to achieve that objective.